Yeah, take your sip of ham. Cheers. Mm. That's actually really nice.
I know.
If any of you want coffee after this, let me know. Dr. Mondkar, thank you so much just for joining me and chatting over coffee. And I just want to get to know you a little bit better, and ultimately so your patients can get to know you a little better. First question I wanted to ask you is, how is your coffee?
This coffee is amazing.
Good.
You are good at this.
Thank you.
I'm
I know.
a coffee connoisseur, so this is awesome.
Good. I'm glad you're enjoying it.
Thank you for my afternoon picnic.
Oh yeah, anytime. So I wanted to ask, what brought you to practicing medicine? You're at the Hemet location, right?
Yes.
Okay, awesome. What brought you, first off, to Hemet and the Inland Empire to practice?
Yeah, absolutely. So I originally went to college at UC Riverside. So I have been kind of part of this community for a while.
Okay.
I always kind of knew I wanted to come back to this area to like treat the patients and the population here, because I know they need it. And the providers are kind of rare and far between. So, and the Hemet area really needed it out of all the locations out here. And
so true.
The population's growing. So,
well, I know like a lot of our specialists, for example, are in the Menifee and the Temecula area.
Yeah,
and so there is such a need for primary care in Hemet. So I'm glad you're filling one of those roles and one of those gaps.
Sure. And we have a lot of older patients out there. So they truly need some good care. So
good care. What would you say is your philosophy of care then? So as you were going into caring for the older population or our senior population in Hemet, what is your philosophy?
So just in general, even for our younger population, I'm very all about preventative care. It's why I went into family medicine. I really believe it's better to prevent fires than put them out, right? So I believe in preventative care, and that's what family medicine is. That's what primary care is. I have a family that actually, I have parents that have gotten older pretty quickly and had a lot of health problems. And I know from that perspective, from the patient side of it, it was really hard to get good care and get after the providers and make sure they're getting everything they need done. So I figured, this is the perfect area for me to be on this side of it now. Yeah.
Now, is that what got you into wanting to practice medicine? Is seeing your parents and wanting them to have the best care?
Yeah, absolutely. It's not really what got me into medicine. What got me into medicine originally was that I really love medicine. I love science. I love learning. And I love talking with people. And unfortunately, I probably spent a little too much time talking with my patients and chatting. But that's how I ended up into preventative care and family care. But yeah.
I don't think any patient would be like, she spent too much time with me.
That never happens. Most of the time, most people are like, I'm glad she spent so much time with me. I'm glad you have so much time.
Yes. I think in this kind of take a number medicine philosophy that the Western world has, it is so special when you find a physician who wants to get to know you. And
absolutely. And I truly believe that's the best way to treat my patients. I know from my mom, a lot more of the medicine was happening and the treatments was happening at home where I'm not. And so it was helpful to be in the room and learn about what's going on at home. So that's what I try to do in my patient rooms. And I make sure that, I know what their lifestyle is and what's going on at home. And then you get a much better and bigger picture of your patients.
Something we always say is extending the care outside of the exam room.
Exactly.
So I think that is kind of encompasses that philosophy, which is cool. Well, you're practicing with Rancho Family Medical Group now with us, and we're so happy to have you. What has been the best part of being a part of the Rancho family?
Well, there's a lot of different parts. Honestly, I've been working for Rancho Family for a while. And so I love seeing the continuity of going from one position to another position, being in the company, and just how much it's grown. It's just expanded so much, and they've still kept on top of preventative care and preventative measures and making sure we're doing as much as we can for all of our patients. And I think that's quite hard for companies that grow at the speed that they're growing. But they're pulling it off. So I love being a part of that.
That's awesome.
Yeah.
Tell me about that journey. So you said, tell us about your tenure with Rancho Family.
Okay. Yeah. So I actually used to scribe for the company. It was a great way of getting started in medicine and learning a lot. I learned probably more than I learned in medical school scribing for the company, honestly. I learned the EMR systems really well. So I'm a kind of weird hybrid, as the company likes to say, because I know the medical side and I'm also kind of a past scribe. So it's great for me. It makes me a little bit more efficient, I think, sometimes with the EMR, knowing the EMR, and then also being able to take care of my patients at the same time.
Well, I think that's even better for the patients, that you don't even have to learn to navigate the electronic medical records, but you actually, you know it because you were in it so much.
Yeah, for sure. And I've always found it really funny because, you know, a lot of providers, if you don't know the EMR, then you lose that eye contact with your patients and kind of closeness. And so I've just learned how to kind of go back and forth because I've just been doing it for so long.
Totally. And well, since you have been a scribe with Rancho Family and now you're a physician, can you tell us the benefits of having a scribe in the exam room with you?
Absolutely. I'm just, you know, it's a lot more efficient and just in general because I really want to spend that time with my patient, focusing on them, watching them, looking at them, knowing their body language, learning about their home and what they're like at home and their personal lives. That's a lot of what I do and how I interpret and help with treatment and management. And so as long as I have a scribe that can take care of the charting part of it, you know, I can spend a lot more time in that relationship with my patient. So.
With that patient. What are some things that you enjoy doing outside of the exam room, outside of the clinic? I know you're a new mom.
Yes, so I am a new mom. So the majority of my time that I don't get to sleeping is spending time with that little baby. He's only 4 months now. So he needs a lot of attention from me.
Yes.
But we also have a husky at home. And so she needs attention as well. She was my firstborn.
Yes. Very vocal.
Yes, she is. Still is. So yeah, we like to get out a lot. My husky has lots of energy. So we take her to the beach. We take her to the park. The baby loves fresh air too. So I love going for walks. Me and my husband and the baby and the dog will go for little trudges.
Sounds relaxing. You like to relax with your family.
Yes, it's very relaxing. And I'm a proponent for spending as much time with your family as you can, especially in these younger years. I know, you know, kids grow up fast. So I tell that to my parents all the time. So I should probably follow the same advice.
Yeah, absolutely. Just take the time with your kids when you can have them.
Yeah. So I like spending time with them. Outside of that, I cook a lot with my mother. Kind of the same thing.
What kind of food do you like to cook?
Indian food most of the time. She's a true and tried and true Indian mom, so she has a lot of good recipes.
That's awesome. I know we
never
cook
make them quite as well as she can, but
yes, absolutely. I know we cooked some today. What are some of the things that we whipped up?
Yeah, we had like some samosa patties that my mom likes to make, and I think we made some chicken tikka masala and I believe some dal. So
sounds pretty plant-based. Well, I did hear chicken.
Yes, there's a little chicken in there, but that's lean meat. Yeah. We'll take it.
Lean meat. We'll take the lean proteins where we can get them. That's awesome. Well, Dr. Mondkar, thank you so much for chatting with me and having some coffee with me and just enjoying
the awesome coffee that you made. But yeah, thanks for having me.
Absolutely.
Yeah.